Good afternoon and welcome to our weekly COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator. We're here each Wednesday at noon for this update, and this forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today we have another wonderful panel on update number 71. Kenneth Tavares, Matt Muratore, and I are joined by a number of guests, including Mark Wilson, also Keane, Carilyn Rains, Joseph McDonald, Michael Jackman, Michelle Bratty, Amy Naples. And we're going to begin with the chair of the Select Board for the town of Plymouth, Kenneth Tavares. Welcome, Ken.
Thank you, Steve. Good morning to everyone. The clock is chiming, so I guess I should say good afternoon. I have a number of things that I would like to convey to the community today. The first is at last night's Board of Selectmen meeting, the skateboard park was closed until November 10th, when the board will take a look at it. This is not a punishment. It is out of concern that most of the users of the park are not wearing masks. We want to take the opportunity to re-educate and to make sure that as the park gets used in the future, that it's done safely. And that's our main concern. I'm sure there'll be lots of other rumors out in the community, but it is primarily because we want to have the participants use a mask. Also, Dr. Pockman has suggested to the Board of Selectmen a week ago that we put a memorial on the green of Town Hall to honor the 82 people that have died in Plymouth from the virus. This memorial will be set up on Monday, this coming Monday, and will remain in place for 30 days. It basically talks about the loved ones that are not going to be at our Thanksgiving tables this year. That will take place on Monday. Last week, the town administration and officials met with the state COVID enforcement and intervention team. They were extremely helpful. They gave the town a great deal of good advice that we're now going through and looking to have further meetings with the state so that we can move ourselves out of the red zone. We also are anxious to watch the Board of Health meeting tonight, because I know that and Karen will probably address it, there'll be a number of very important subjects discussed. The Board of Health has made it clear that they need assistance in outreach and enforcement. The Board of Selectmen is prepared to support the Board of Health. All in all, our goal is to move this community out of the red zone. And this is something that we can do together, one step at a time. It's going to require action on our part that may not be entirely pleasant, but we know we have the resources available to us to do it so that we can have some type of normalcy in the town of Plymouth. Thank you, Steve.
Thank you, Kenneth Tavares. He is the chair of the Plymouth Select Board. We begin our panel with a health segment each week, and we're going to begin with Dr. Mark Wilson. He is Professor Emeritus. He is with the University of Michigan School of Public Health. He is an epidemiologist from Plymouth. Good afternoon, Mark.
Thank you, Steve. Let me start, as I oftentimes do, with some questions that I've been asked recently. The first one is, with the cold and flu season coming, how will I know whether my symptoms are COVID-19 or just a normal seasonal flu? So at least when symptoms are just beginning, it can be really difficult to distinguish between COVID-19 and influenza. Generally, you won't be able to tell which illness you have because they share many symptoms. One COVID symptom that is not commonly associated with the flu, of course, is loss of taste and smell. However, not everyone with COVID loses taste and smell senses, and therefore people with allergies, for example, or a cold might all have altered taste or smell because of a stuffy nose or over-the-counter medications and so forth. So that in and of itself certainly won't help you either. In general, influenza and COVID both have fever, chills, shivers, very often a cough, often fatigue. With influenza, there's often headaches, sometimes with COVID-19. Body aches are frequently seen with influenza, sometimes with COVID-19. And then there are other symptoms that sometimes occur in both, for example, sore throat, diarrhea, nausea, congestion, and so forth. Sneezing, interestingly, is rare in both. And as I mentioned, you almost never have loss of taste or smell with influenza, and that's frequently, well, sometimes the case with COVID-19. It's very rare, however, with influenza that you have shortness of breath, and that's very frequently the case with COVID-19. So in order to confirm which infection you might be dealing with, you need to have a nasal or throat swab test that will look for one or the other of these two viruses. You could have either the flu or COVID and might even have both at the same time. There's some evidence that suggests that being infected with either the flu or the COVID virus puts you at greater risk of infection by the other one. And this could happen if your immune system is weakened or if your respiratory system is more susceptible. On the other hand, interestingly, if you think about it, if you're sick with one, you should stop interacting with people at work, at school, or out shopping. And so your risk of contracting the other could actually be reduced during that time. Regardless, most health experts would suggest that the COVID pandemic makes it all the more important that everyone receives this year's flu vaccination. Although that vaccine won't protect you against COVID virus infection, it will reduce circulation of influenza viruses in the population. But remember that getting the flu vaccine doesn't mean that if you have flu-like symptoms, that it must be due to COVID. The annual flu vaccine is never 100% effective, as I think most people know, and this is because the influenza virus changes every year. So you could have flu even if you've been vaccinated. Regardless, the prevention measures being used against both COVID, masks, and hand washing should also reduce your exposure to influenza. So this raises another concern that I want to briefly mention. Public health officials and healthcare providers are worried about essentially a double whammy involving severe flu cases on top of COVID cases that will really overwhelm our healthcare system. Since both are likely to occur during the upcoming winter, we want to do everything to prevent the added burden of influenza. Again, this is why you want to be sure and receive an influenza vaccination. It's interesting that a bad flu season had been predicted in the southern hemisphere earlier this year, but this never happened. And remember that the southern hemisphere's winter occurs about 6 months before ours does here in the northern hemisphere, and that's when their flu season occurs as well. In fact, there was very little flu there this year, and research suggests that strict control measures addressing COVID were actually also, and these of course included serious lockdowns in the southern hemisphere, school closures, bans on travel, and so forth. These had a huge impact on influenza. So the big question is whether in the US and other countries in the northern hemisphere, there might also be less flu this coming winter. Unlike what happened in the southern hemisphere, we now have schools and businesses that have opened. International travel is possible, and there's still some public health resistance to masks and physical distancing. So perhaps with the increased COVID transmission that's now occurring and a return to more control measures, both influenza and COVID will be less than predicted. Let's hope so. These precautions along with other widespread influenza vaccination could mean that our flu season might actually be milder than we've had in many years, but this is going to require individual adherence to prevention recommendations. Another question that I was asked, my husband, kids, and I are thinking of driving to Wisconsin to visit family members who we have not seen in almost 10 months. What are the risks of doing so? And are there ways to reduce chances of becoming infected with the COVID virus on such a trip and to reduce risk of infecting others while there? I suspect this is a question that many of the viewers have asked of themselves or their friends. And so I just wanted to offer a few thoughts on that. First thing that I'll suggest is that you should consider getting everyone tested and making sure that you have those results before you travel. If anyone has a positive test, obviously you should stay home and make that reunion some other time. Even if you've all tested negative and no one has symptoms, you still need to be careful. Remember that a negative test only tells you if you do not have detectable virus, coronavirus, that day. You may have already been infected and there's just simply not enough virus to be detected by that test. Or you may become infected after the test and before you arrive at your destination. Secondly, the family members who you're going to visit should also use a couple of weeks before your visit to limit their own exposure as much as possible. I think we all realize that total quarantine is really, really difficult, but they should at least be sure and wear a mask while they're in public settings and limit their own activities outside the house. And this will then help to protect you who are visiting. For the car trip there's plenty of evidence to suggest that visiting indoor public venues considerably elevates your exposure risk. So for the drive, you should try and pack any food and drink, use drive-throughs for purchasing food if possible. And when you're filling your tank, risk should be relatively low because this is an out-of-door setting. And you're normally distanced from others there, but try to pay at the pump with a credit card if you can. If you have to stay at a motel on the road, make a reservation ahead of time, ask about their COVID-related cleaning procedures, and try to request a room that was empty for at least a day if possible. Once you arrive, I would suggest considering staying at a nearby motel instead of staying at your family's home, because this will help reduce the exposure on both sides. When you're actually visiting with your family members, try to do it outdoors if possible, although that's obviously not easy during this changing season period. And if possible, try to open windows indoors so that there's more airflow. And everyone should try to wear a mask and keep physical distance in mind. Although we know this is not easy with family members who you've not seen in a while. Perhaps the most important thing to think about, though, is what amount of risk are you willing to accept to make this trip? The older you are, the more severe these symptoms can be, COVID symptoms can be. Although anyone can experience life-threatening symptoms, anyone of any age. So even if you're meticulous in your preparation and caution, the risk of contracting COVID might still be too high for your comfort level, especially if you have a chronic health condition. So you might consider this to be an exceptional holiday season and postpone the visit to reduce risk to you and your loved ones. The situation is almost certainly going to be much better this time next year. Finally, one quick note that I'd like to share with everyone. I regularly receive a free email update on COVID-related information from the CDC, Centers for Disease Control and Prevention. And I'd encourage anyone who is interested to subscribe as well. You can do so through their website, which is tools.cdc.gov. That is tools.cdc.gov. And I wanted to just briefly share some helpful suggestions from an update that I actually received yesterday. First, one of the items in the material they send is a toolkit for youth sports. And this includes resources to help youth sports administrators, coaches, and parents protect their players and communicate with their communities. And this toolkit includes guidance and planning documents, web resources, frequently asked questions, posters, fact sheets, and so forth, and related videos actually as well. And so it's really full of information. But a few COVID risk issues stood out to me, and I just want to share these. First, and not surprisingly, they note that the risk of being infected with the COVID virus varies with the type of sport and location of those sports activities. In general, risk increases in youth sports settings as follows. The lowest risk is when you're performing drills or skill building activities, conditioning even at home or either alone or with family members. That's clearly the lowest risk. Then with increasing risk, team-based practice, even greater risk within team competition, even more risk with full competition between teams in the same geographic areas. And then the highest risk is full competition between teams from different geographic regions. And more specifically, CDC explains ways in which the sports are played will influence that risk, including the way equipment is shared and so forth. I won't go into the details, but it's a very useful example of information that you can obtain from this website. There are many other topics, and just a few to mention that were in this last update. Suggestions for Halloween. Clearly, this is something on everyone's mind this week. There's a toolkit for businesses and workplaces that CDC offers lots of insights through. How COVID-19 spreads, the COVID-19 case daily update for all states in the US, and just many other useful sources of information, authoritative information. Guaranteed there is no fake news in this material. So anyone, again, can access this free information from the CDC, have an email sent to you each week if you wish. The website, again, tools.cdc.gov, that's tools.cdc.gov. So I'll stop here and would be happy to answer any questions from viewers later on in the broadcast.
Thank you, Dr. Mark Wilson. Those are good common sense suggestions for the holidays. We're going to continue now with Keane. She is the Director of Public Health for the town of Plymouth. And because we have a large number of panelists and many questions coming in, I'm going to throw out a couple of questions as each panelist comes on. And Karen, Stacy asks, why doesn't the Plymouth Department of Public Health report numbers on Facebook page? Specifically, I think she's referring to prisoners or patients at the detention facility. And her second question was also, there was a security team appointed by the Board of Health and approved by the Select Board last night, and focused, were they going to be focused in all areas of Plymouth or only in the waterfront and downtown area? So those are a couple of questions that have come in today. But Karen, welcome.
Thank you. Would you like me to answer the questions first before I go on?
You do it however you like as part of your presentation.
Okay. Well, I think it's important that we do talk about the question, talked about the security team. We're referring to them as COVID ambassadors. And what they're going to be doing, they're people who will be hired through the town of Plymouth to do essentially several responsibilities relating to COVID. The first is, and they'll be all over town. It won't just be the waterfront, so that will be an important area that they'll be going to, but they will be all over the town of Plymouth. They'll be greeting residents and visitors. They will encourage good public health behavior, which is wearing masks, socially distancing, following protocol for restaurants and retail businesses. They will be writing and distributing any citations or violations. We hope these won't have to be given out, but if they do, then they will be authorized to do such. They'll be reporting back to both the Board of Health and the Department of Public Health regarding any observations that they've made, any areas that they see that may need improvement. and also the number of violations that have been given out. Those will be reviewed by both the Board of Health and the Department of Public Health. So we can see if there are areas that need additional training. And then the ambassadors will also be available to participate in any training that we develop to address any areas of need that they saw while they were out doing their greetings and working with the residents, business owners, and visitors to the town of Plymouth. So I think I'll touch on that before I started my presentation. So hopefully that answers any questions. We're excited to have them on board, and we think it's going to do a lot to help out with education for our residents and visitors, and to also make sure that everyone is following protocol and that they're in compliance. So to continue with something that a lot of people have been asking about and on everyone's mind is, what is the town of Plymouth doing about Halloween? Well, the town has not canceled Halloween. Through the Board of Health and the Department of Public Health and the Select Board and the town administration, we are following the guidelines, the Halloween activity guidance released by the Centers for Disease Control and Prevention. And I'm going to try to share my screen, which I've never done before. So here we go. So what we are encouraging people to do for Halloween is to follow 3 levels of risk activities. So the first are lower risk activities, and these are considered to be safe alternatives to what you would consider to be your normal events for Halloween. So these are lower risk activities: carving and decorating pumpkins, decorating your house or apartment living space, perhaps doing a Halloween scavenger hunt, where your children are given lists of Halloween things to look for while they walk outside, house to house, having a virtual Halloween costume contest, having a Halloween movie night with people that you live with, having a scavenger hunt style trick-or-treat search with household members in and around your home rather than going house to house. Those would be considered the lower risk activities. Now, the moderate risk activities would be participating in one-way trick-or-treating, where individually wrapped goodie bags are lined up for families to grab and go while continuing to social distance. So this would be something that you would put at the end of your driveway, perhaps, or along the edge of your yard. If you do choose to prepare goodie bags, wash your hands with soap and water for at least 20 seconds before and after preparing the bags. You could have a small group, outdoors, open air costume parade where people are distanced more than 6 feet apart. You could attend a costume party held outdoors where protective masks are used and people can remain more than 6 feet apart. Caveat: a costume mask, such as for Halloween, is not a substitute for a cloth mask. A cloth mask should not be used unless it is made of 2 or more layers of breathable fabric that covers the mouth and nose and doesn't leave gaps around the face. Do not wear a costume mask over a protective cloth mask because it can be dangerous if the costume mask makes it hard to breathe. Instead, consider using a Halloween-themed cloth mask as part of your costume. Another moderate risk activity would be going to an open-air one-way walk-through haunted forest where appropriate mask use is enforced and people can remain more than 6 feet apart. I thought this was funny. If screaming will likely occur, greater distancing is advised. The greater the distance, the lower the risk of spreading a respiratory virus. Visiting a pumpkin patch or orchards, people using hand sanitizer before touching pumpkins or picking apples, wearing your mask is encouraged, also maintaining social distancing. Having an outdoor Halloween movie night with local family and friends with people spaced at least 6 feet apart. Again, if screaming should occur, greater distancing is advised because of the lowering the risk of spreading a respiratory virus. Higher risk activities. These are activities to avoid if you want to help prevent the spread of the virus that causes COVID-19. They would be participating in traditional trick-or-treating, where treats are handed to children who go door to door, having trunk or treat, where treats are handed out from trunks of cars lined up in large parking lots, attending crowded costume parties held indoors, going to an indoor haunted house where people may be crowded together and screaming, going on hay rides or tractor rides with people who are not in your household, using alcohol or drugs which can cloud judgment and increase risky behaviors, or traveling to a rural fall festival that is not in your community if you live in an area with community spread of COVID-19. So those are the levels, the higher risk levels, the moderate risk levels, and the lower risk levels for Halloween. And then also, one other little slide to share with you would be steps to take if you are going to go trick-or-treating. So those, from what we can tell from social media that we've done a little research on, there are still some neighborhoods in Plymouth who plan on having traditional trick-or-treating. So if that is going to happen, there are some things that you can do to plan on to make it safe, a little bit safer. Avoid direct contact with trick-or-treaters. You can see that we're 6 feet apart as we're walking down the street to do our trick-or-treating. We're giving out treats outside if possible. Set up a station with individually bagged treats for kids to take. Wash hands before handling treats and wear a mask. Again, we talked about wearing a mask, and a costume mask is not a substitute for a cloth mask. Here we see our children are having cloth masks that are part of their costumes that have been decorated so they look like it belongs to the costume. Stay at least 6 feet away from others who don't live with you. Wash your hands, bring hand sanitizer with you. So as you do go door to door, you can use your hand sanitizer after touching any objects such as candy you may be receiving from other people. The hand sanitizer should be at least 60% alcohol. Parents should supervise young children. And remember to wash your hands with soap and water for at least 20 seconds when you get home and before you eat any of your treats. So that's going to conclude what I want to share with everyone today regarding safety tips for Halloween in the town of Plymouth. Thank you.
Thank you, and that is Keane, and she is the Director, Public Health of the town of Plymouth. She'll be available to answer more questions which we have coming in. But now we're going to go to our education segment, and once again we welcome back Carilyn Rains. Carilyn is the Director of Health Services for the Plymouth Public Schools. Welcome, Carilyn.
Thank you. Thank you for having me. I appreciate it. So I think I'd just like to start off by just giving a brief introduction regarding the successful process I think that we've been able to implement in our schools thus far, looking at, mainly evidence-based practice. Really have been very fortunate to have the opportunity to work closely with Keane in the Department of Public Health in Plymouth, having a lot of close communication with her, as well as with Barry Podfin and the Board of Health. I think it's really important that everybody understand that this is, a very collaborative process in keeping our students and entire school community healthy and safe. I think one of the other important pieces is that we have a great relationship with our school physician consultant, who we communicate with regularly as well as epidemiologists, a number of epidemiologists actually from the Department of Public Health, who we confer with on specific cases that we have questions. We've had a lot more questions regarding specific cases that we're just not sure of, maybe of making sure that we're handling them appropriately. I think that another big piece is the community providers, pediatric providers and local community providers in Plymouth that we are also able to speak with on a specific number of cases. Our superintendent is in very close communication with the Department of Education, who we work with on a regular basis as well in terms of maintaining the safety in our schools. So I don't think I've really left anybody out. I do really want to give a shout out to the school teams I feel like my school nurses have worked extremely diligently and hard on educating their entire school communities on a daily basis. There's a lot of outreach to families and individual students as they are quarantined, isolated, and as they return to school. We've been very fortunate thus far due to some of the, obviously the prevention strategies that were put in place that have been already alluded to in the conversation, whether it's hand washing, face coverings, physical distancing, I think, which has so far kept any spread of COVID out of our schools. The majority of cases have been household transmissions that have occurred thus far. We've been really fortunate in terms of the transparency that our families have had with us, very frequent communication of questions and concerns around illness. I think that the district has also tried to be very transparent in our communication back. I mean, we send letters if there is a positive case in the schools immediately out to the entire school community, making them aware that, if they were a close contact, they would certainly be notified. We have our district dashboard that we are contributing to every Friday afternoon with a weekly update in terms of what's going on around quarantining, positive cases for both teachers and staff, teachers and students. I think that's really important. We've also tried to stress in terms of another primary prevention piece is notifying our families about the importance of getting that flu vaccine taken care of with their children and their entire family before the deadline date of December 31st. We've done a lot of education on that. I think that weekly email reminders that the superintendent has sent out on symptom monitoring, distancing have certainly also been very helpful. I think that we need to examine very frequently, some of the things that we may moving forward need to address. Dr. Campbell has put together an advisory team that consists of school community members and also people from the members of the community at large, school committee, director of public health, board of health, parents, students. And we're looking at, and they're divided into separate committees, some dealing with health, some with curriculum, because I think one of the bigger pieces that we need to remember here is that the most important focus in schools is time on learning and academic achievement for our children. And that is our primary focus in terms of keeping our schools open, keeping all of our kids and staff healthy and safe so that we can continue to move forward with the hybrid model that we're utilizing now. It's not perfect, certainly. I think our teachers also really need to be applauded because they're doing so much work both remotely and with in-person learning with two groups of kids. I think that's really critical for people to really understand and appreciate the dedication and the commitment and time that the teachers are putting into this piece. Because it is, this is a learning environment and we don't want it clouded too much around, COVID talk all the time or whatever, but we are very pleasantly surprised at how great our kids have been doing in terms of their compliance with the face masks and the distancing. I think all of our kids really understand the importance because I think they all want to stay in school. It's really important for a number of reasons to keep our children in school. So I'm, again, happy to answer any questions anybody may have at the end of the program. Thank you.
Thank you, and that's Carilyn Rains, and she is the Director of Health Services for the Plymouth Public Schools. We're now going to welcome back the Plymouth County Sheriff, Joseph McDonald. And Joe, as we begin your presentation, one of the questions from our listener would be how to get numbers reported regarding prisoners or patients at the detention facility in the state forest. How do we get numbers as to what are the COVID-19 numbers? So again, welcome.
So thank you, Steve. It's good to be back with you, and I missed a couple of invitations, which I very much appreciated. One due to the sheriff's meeting, and then unfortunately and fortunately, I missed one because I was out sick. I had a little bout of pneumonia. I was non-COVID, thankfully, and I was treated over here at BID Plymouth, and I would be remiss if I did not give a shout out to the medical staff there at the BID Plymouth. What phenomenal care I felt I received over there. It was really very impressive. So we just another blessing. And when I count my blessings, I count the folks over there at the BID Plymouth. So with reference to questions of the individuals within the state forest, that is not anything that is run by this agency. That is run by the Department of Corrections. But the good news is that you can get those numbers. Those numbers are all going to be reported to DPH. They are also reported separately and individually by the DOC to the Supreme Judicial Court. So those numbers would be available on mass.gov. You can go to the SJC website. In all 14 counties, the sheriff's offices are making those, or actually 13 of the 14 that have correctional facilities are making those numbers available. And then the one sheriff's office does not have a correctional facility, but the DOC is included in that as well. And that's part of the SJC order that we are all complying with that goes all the way back to early in the spring. With reference to how we are doing here at the Plymouth County Correctional Facility here on Long Pond Road, I'm very happy to report to you that our numbers have been very low and very, very steady. Going back to March, I'm informed that we have had 87 tests, 4 confirmed COVID cases amongst inmates, and most of those were, well, actually 2 of those were inmates on the way in who were being placed in quarantine anyway. They self-reported and tested positive. And 2 of those 4 were inmates who had been released from the correctional facility, and at some point in time after their release, they tested positive. We were notified by DPH, so we are, out of an abundance of caution, counting those in our numbers as well. So 4 inmate cases. The number of correctional officers that we have had that have tested positive, 7 correctional officers. And as of the end of last week, that number was 4. We had 3 this week, which is a lot of individual officers, but they are, I'm happy to report, doing well. They're in quarantine. Other staff members, we had 7 other staff members. So those would be people who work in non-security type positions. That would be caseworkers, people like that. So we have had 4 inmate cases, 14 staff person cases since March to present. And I'm happy to report that we had no fatalities, thank God. And everyone is either recovered or in the process of recovering. So we have been very, very lucky that way. I will also note that our daily census, we get this every day, is 630 individuals who are currently being held here at the correctional facility. So we have been very, very lucky, but I think it's a result of a lot of hard work by our staff. They have worked very hard to engage in public education with our inmate population. We also have revamped all of our cleaning and sanitation, and it seems to be working well. So I think the news from here is, although we are not COVID-free by any means, we certainly are doing everything we can to keep those numbers down, and everyone seems to be cooperating. So I think things are working well. That's the report from correctional facility.
Thank you, and that's Joseph McDonald. He is the Plymouth County Sheriff. We also received a notice this morning from one of Sheriff McDonald's colleagues at the county level. Matthew McDonough is the Register of Probate, and he's announced that due to a positive COVID-19 test, the court building in Brockton is closed today for our cleaning. There will be continued in-person operations for the county probate court here in Plymouth, as well as remote. So in terms of managing our expectations, this has happened in the past, and when it does happen, the buildings are closed in order to take the precautions necessary. And now we're going to have our federal representative, Michael Jackman. He is the district director for Congressman Bill Keating. Welcome, Mike.
Thank you, Steve, and thank you as always to PAC TV for the opportunity to be on the program this week. It's always great to hear from all the other panelists to find out what's going on in the county, on the town, the state level, and all the great things that are going on to try to keep people safe and keep people healthy. which is so important. The pandemic is still here, as we know, and it's not going away anytime soon, unfortunately. We need to do all we can to protect ourselves and our loved ones. And part of the impact of the pandemic is, as we know, financial. There are people who are out there who are hurting, who have lost jobs, who are underemployed. And we're trying to do as much as we can to support those people. We do anticipate another federal relief package, but I can't tell you when that's going to be, unfortunately. The negotiations are ongoing. Obviously, we have an election, federal election in 6 days that is going to have an impact on that. So I don't anticipate we'll have anything before the election. I am hopeful that there will be something before January, however. I think the election is sort of putting things on a I don't want to say back burner, but it's taking precedence at this time. So looking back to the previous CARES relief package that was passed in March and has had an impact and is still unrolling, as it were. One thing that the IRS is really asking us to do is to point out to folks that there are still many people who qualify for a stimulus payment, the $1,200 check with the $500 supplement for children who have not received it yet. And a lot of the folks who have not received it yet are people who do not file a tax return on a yearly basis. So it's important to note that if you are in that position, in that category, you have until November 21st to go on the IRS website and use the non-filers portal to enter your information. This would apply to people who, as I said, did not file a tax return in 2018 or 2019, may or may not be on the Social Security rolls. So you may be receiving Social Security benefits, but still not be getting, having that information processed so that you can get a return, get a payment, and or a VA beneficiary as well. So they are doing a big push. We're going to be sending information out to Councils on Aging, which I know we'll hear from Michelle in a little bit, but also other agencies who work with low income and the underserved community to make sure that people know that they can access the IRS website, then they can put that information in to find out if they qualify and enter the information so that they can qualify to receive that payment. So that's very important for folks to know. And if anyone has any questions, as always, our office staff is available through our website and through our telephone number. In Plymouth office is 508-746-9000. Folks have any questions about that or about any other federal agency, they are urged to give us a call, and we'll do the best to help them. Thank you, Steve.
Thank you, Michael Jackman, District Director for Congressman Bill Keating. And we're now going to move on to Michelle Bratty. She is the Director of Elder Affairs for the town of Plymouth. Welcome, Michelle.
Thank you, Steve. Great to be here. Thank you to PAC TV for having me as a guest, and hello to all the amazing panel guests. I think the theme here today is concern for our town and each other regarding COVID red status. We took a step backwards, and regardless of where you stand on the proverbial political side of this pandemic, I am sure we can all agree that backwards and reverse are not goal aspirations for our town, community, small businesses, and families. Even if you do not believe you will be impacted health-wise by this virus, the impact to all of us is felt in some sustained way until the virus is either contained, treated, or cured. Oftentimes, as the Director of Elder Affairs, it's my job to be the spokesperson and advocate for Cal and Plymouth's senior population. You should also know that it is an honor to do so. While that will never change, sometimes you, the public, need and deserve to hear from the source itself, as their voices are so much stronger in unison than mine. So please, take a moment and truly listen to what they have to say. Julie, could you please hit play?
We wear a mask because we care about each and every senior in this town.
I wear a mask to protect my family, my grandchildren, my great-grandchildren, my great-great-grandson, and myself.
I wear a mask because I want to protect my husband, my children, and to help keep the Plymouth community healthy.
I wear a mask because we're all the same in our responsibility to each other and to ourselves and our families.
I wear a mask because I wish to protect my children, my grandchildren, and my great-grandchildren.
I wear a mask because I think it's the right thing to do. Don't you?
Thank you. We are grateful to our town manager, the Chamber of Commerce, and the Plymouth Public Schools for collaborating on this PSA project in hopes to bridge the COVID generation gap and all work collectively towards curtailing the viral spread. Those are real people in your community that you just saw. I encourage each person who is listening to ask yourself the same question. Exactly who would you wear a mask for? Even if you are someone who thinks it may not be necessary, who would you actually make that sacrifice for? If any one person comes to mind, that one person's needs that you would put above your own, then please make the sacrifice and wear a mask. Even if you don't think you should have to, please consider at the very least giving someone who is scared or statistically at a higher risk from COVID peace of mind. Why do I wear a mask? Because we should, without hesitation, honor, value, and respect this pandemic's most at-risk population, each and every senior in our community. That's right. If even there was a 1% chance that a mask could somehow provide some protection for the elders you love, would you truly gamble with that? In a world that currently feels that each of us lack the power of control, we actually have the control to choose to err on the side of caution and protect ourselves, each other, and our elders in this community, one individual at a time. Thank you, Steve.
It's a great PSA. Michelle Bratty is the Director of Elder Affairs. She gave us, again, a good segue to go into Amy Naples, Plymouth Area Chamber of Commerce, who collaborated on this PSA. Amy, you've been doing a lot of collaboration with a lot of groups, a lot of organizations, a lot of people. Welcome.
I sure have, Steve. That is one tough act to follow. Michelle's so well done. You pulled at my heartstrings. I saw the video before, but it still brings a tear to my eye. And I think the messaging is just so important, and it speaks to everybody in our community. And I thank you for your hard work and for the seniors that participate in that, because I think it will definitely drive home the important messaging and for others to do so. So thank you for that. And Michelle, you are absolutely correct. We have taken a step back, and we as a chamber are continuing to work very hard on education and recovery efforts with our organizational partners like the Town of Plymouth, the CAL, the PAC TV, and other amazing organizations in town. Last week, the Plymouth North VPA students in the graphic and photography class assembled their first art installation at Plymouth Skate Park. As you will all probably already heard, sadly, it was vandalized and destroyed just days later. I am extremely disheartened by these acts, but this certainly cannot stop us from continuing our efforts. Our community deserves better, and the students who created this artwork certainly deserve better too. So in the coming days, students will be creating a second marketing campaign at Forges Field as this town-wide collaboration to encourage the community to wear masks is so important for our recovery efforts. Not only just the health of our community and the great people in it, but it's also the health of our local economy. I Wear a Mask Because marketing campaign is truly a positive way of involving the entire community. Everyone should get involved, jump on their social media pages and share why they do wear a mask. It's just so important for us to be continuing these efforts. In addition, we have been filming with local businesses this week and working on posters in these businesses, again, to inform and educate our community and hitting home with very important messaging. Once we realize the importance of coming together and being on the same page, we will be able to overcome the challenges and continue this and stop the spread of COVID-19 right here in our Plymouth community. I'm thankful for the leadership in this town and state. Everyone has been working together around the clock, and we need help from members of the community. So let's all do our part to keep businesses open, citizens of the community healthy, and children in our schools. Other related chamber news, we do have a couple of virtual events I wanted to share with you all. November 2nd through the 6th is Veteran Small Business Week, and we are very excited for Veterans Edge. EDGE stands for Engage, Develop, Grow, and Elevate Workshop, which is in collaboration with the SBA. Attendees will learn about the SBA, its resource partners, free support services available, and specifically around veteran-owned businesses and certifications and contracting that is available for veteran-owned businesses. We'll also feature 3 veteran business owners, Jesse Brown, Matt Logan, and Scott Snyder, who are all local veteran-owned businesses here in Plymouth or from Plymouth. They will share their stories of success, challenges, and lessons learned, and also how they continue to grow their business amid the COVID-19 crisis. So if you know a veteran who is thinking about starting a business, that has a business, please encourage them to join us for this virtual business resource event on Thursday, November 5th, 9:30 to 11:30 a.m. You can find the link on the Plymouth Chamber website and certainly through our Facebook and Instagram social media platforms. The second virtual event is the Chamber is hosting a nonprofit webinar on Thursday, November 12th, 2 to 3:30 p.m. on the topic brand pivots nonprofits should be making right now, which they probably aren't. As we are all aware, in-person events are canceled, fundraisers are scarce, donors are disconnected, and nonprofits need to start running more like a business, mission-driven consumer brand than an actual nonprofit. So we have enlisted Megan Lynch, a brand specialist and CEO of 6 Point Creative, and she will teach this fast-paced interactive workshop to nonprofit leaders. So we hope anybody that is interested in attending are certainly more than welcome to. It is free to do so. And again, you can find that information on PlymouthChamber.com. And as we know, the colder months are upon us and will be some of the most challenging for our small businesses. So we are working one-on-one with any small business that needs advice, whether you're a chamber member or not. We'll help you with creating ideas, opportunities, also assisting with making sure you have an online purchasing presence. We are also going to be creating some email blasts that share advice, marketing pieces to our local businesses, just so that they can help boost some sales this holiday season. And as the chamber, I always try to bring cheer, and the holidays are certainly no different. And with that being said, the chamber is working on some great cheerful opportunities for you to support our local businesses and enjoy the holiday season. So we have been working on some great plans, and I cannot wait to share with you in the coming weeks. So be sure to follow the Plymouth Area Chamber on Facebook, Instagram pages, and of course, visit PlymouthChamber.com for this exciting announcement. But we are truly committed to keep cheer here in America's hometown. And that is my chamber update for today.
Thank you, Amy Naples. She's the Executive Director, Plymouth Area Chamber of Commerce. Again, the I Wear a Mask PSA was produced by PAC TV. We want to thank PAC TV for their support of this program as well, each and every week. And Amy mentioned that we should also recognize the leadership at the state level, and I guess that brings us to State Representative Matthew Muratore. Welcome, Matt.
Hey, Steve, how are you today? Good to see everyone. You know, I don't know if it's Karen's discussion about Halloween, but I don't know about all of you, but doesn't Carilyn Rains look like Jamie Lee Curtis? Take a look at her for a second, doesn't she? I know the sheriff thinks so, but I think it's just all the Halloween talk, maybe. I don't know.
Maybe.
Well, anyways, we are in the midst of somewhat of a surge, but we're still in better shape than we were before. I love the PSA that the Cal put together, and we really need to get that out to the community. Because when you look at the numbers, you know, the number of deaths we've had, 9,664 deaths to date, you know, that's 82% of those people have been over the age of 70. You know, and 66% of those have all been in long-term care facilities. So it does affect the elder population, and that's the people we're protecting. That's why we wear the mask. It's not just for us, it's for the people that we love, and particularly the elderly people that we love. So great job with that, and continue to get that out everywhere. When we start looking at the stats throughout the state and the county and the town, we're looking at the number of tests so far have been 2,665,975 individual tests in the Commonwealth, with 149,361 confirmed cases. And again, as I said, 9,664 deaths since we've started this. The 7-day weighted average is now 1.7% compared to 30 days ago, which was at 1%. The number of patients in the hospital are at 567 throughout the Commonwealth, with 30 of those at BID. The number of those, and that compares to 393 back on September 27th, which was 30 days ago. ICU, throughout the Commonwealth, we have 109 patients in the ICU, and 47 of those are on ventilators. In Plymouth County, we have 11,294 confirmed cases, with 828 deaths. And to date, well over 265,000 people have been tested just in Plymouth County alone. When you look at the town of Plymouth has 881 confirmed cases since we started, with 56 active cases at this point. And we've tested over 30,000 people here, or close to 30,000 people here in the town of Plymouth. And we've had 82, unfortunately, that die from COVID. When you look at the, you know, there's been a lot of discussion at the state level the last few days that 4 days in a row, we've hit over 1,000 cases of confirmed cases. The last time we've seen even 2 days in a row was May 20th to 21st. But when you look at the weighted average, then it was 9.4% compared to 1.7% now. There were 2,300, almost 2,400 people in the hospital on May 21st, compared to now 567. The testing and the knowledge and the hospital preparedness is so much better now. We've learned so much in the last 6 months. Yes, we'll continue to see a surge, but we are better equipped in our healthcare facilities than we were with things like PPE, respirators, and things of those natures. So we are in much better shape at this point. But when you do look at the cases, it is telling. You know, when we were talking, Steve, back in April and May, I would often give the age ranges, you know, 0 to 19, 20 to 29, 30 to 39, 40 to 49, and so forth. And the chart would always go up. It would look at, there were very, very little, if any, cases 0 to 19, and the higher cases were over the age of 80. Well, now it's just the opposite. When you look at the last, the 2-week period from October 5th to October 18th, the highest category of confirmed cases now is between the ages 0 and 19. That's at 1,914 cases. The next highest category is ages 20 to 29. There were 1,813 confirmed cases. Then the third category was ages 30 to 39, and there are 1,610 cases. Age 40 to 49 was 1,422 cases. Age 50 to 59 was 1,333 cases. Age 60 to 69 was 772. Age 70 to 79 was 405. And the lowest amount of folks getting COVID were 80 plus years at 297. So you see what's happening is the older population is getting this. They're staying home, they're wearing masks, they're doing the right things. But we now have to get the younger population to do the same. As that video showed, this is the population we are trying to save, and we're trying to get through this until we get a vaccine in place. So continue to wear masks. You know, controlling COVID is good for the economy as well as the health in our schools. So let's continue all working together. Thank you, Steve.
Thank you, Matthew Muratore, State Representative, Town of Plymouth. We're now going to go back through our panel for closing thoughts. Dr. Mark Wilson, you talked among other things about the holidays, and I know in our family we've greatly scaled down. We'll be going, my wife and I, to my daughter's, be just 4 of us, and then we're later go to my son's, and because he has a young child, he's hoping for good weather. He wants to gather for dessert outdoors. So what would be a takeaway today from you?
Well, despite the disruptions that this pandemic is forcing upon us, what we've heard is there's still relatively simple ways to remain safe. None of us likes the behavior changes that are required to reduce transmission. However, if we don't practice safe behaviors, we know that that can have devastating effects on family members, friends, or others. So these simple behaviors of wearing a mask, keeping our distances, and being thoughtful of others really are it's so little to ask. It's really a matter of accepting this as the new but temporary normal and thinking about how you might feel if you became infected, or even worse, if you infected someone else. As Michelle noted, honor, value, and respect your family and community members. Remember, this too will pass, but until then, please practice safe behaviors.
Thank you, Dr. Mark Wilson. He's Professor Emeritus at University of Michigan School of Public Health. He is an epidemiologist. We're now going to be joined once again by Karen Keane. Karen, we have a question that came in, and several, but one would be, will there be a COVID-19 test facility set up that does not require physician referrals, possibly drive-through testing?
Thank you, Stephen. That's a great question, and it's something that we're currently working on through the Stop the Spread program to have a drive-through facility set up here in Plymouth. There really does need to be one, not only for the Plymouth area, but also for the rest of South Shore and Cape and Islands. In the meantime, CVS, Exit 2 in Cedarville, has set up a drive-through facility at their location that does not require a doctor's note, but it does require an appointment through CVS. And then you stay in your car, you go through the drive-through, and you can receive a COVID test. So that is a new location that has begun here in Plymouth. But yes, we are definitely working on a larger location that all people can go to for a COVID test without having a doctor's order, and we hope to have that soon.
Thank you. Karen, any further takeaway from today's presentation?
I would just, again, I always go back to my big 3, which are wear your mask, social distance, wash your hands. I mean, those are the 3 big things we have to keep doing in order to keep ourselves safe, the people that we love safe, our visitors, our residents, you know, our businesses thriving, things that have to keep happening here in Plymouth so we can continue to be happy and healthy. And I wish everyone happy Halloween, and I hope that you follow the guidelines that we discussed so that we can also have a happy and safe Halloween for our residents. Thank you.
Thank you. Karen Keane is the Director of Public Health for the Town of Plymouth. We're going to go back to Carilyn Rains. She's the Director of Health Services, Plymouth Public Schools. Carilyn, we don't have a question. We do have a comment, though, and the viewer writes, "Thank you for all of your hard work. You're doing an amazing job keeping our kids safe." What do you want us to remember today?
I think I'd just like everybody to remember the collective work that everybody's doing, and I really appreciate having the opportunity to listen in today to all of the panelists, because I think it just speaks to all of the great collaboration that's going on across the town of Plymouth, and just thank everybody for all of their work and efforts, and certainly, of course, that does include our school community, because without everybody working together, we're not going to be able to stay healthy and safe. So again, thank you.
Thank you, Carilyn Rains, Director of Health Services. We're going back to Sheriff Joseph McDonald. Joe, you work at the county level. You mentioned, I know we were going to have you last week, and you met with sheriffs from throughout the state. So you're all working together, is that right?
That is very, very true, Steve. You know, the sheriffs, we're a very collegial group. There's only 14 of us statewide, 14 counties, 14 sheriffs. But we meet, and I say meet, we traditionally have gotten together, but under the current circumstance where we started with conference calls, which we were doing initially daily. And now we're down to at least monthly, bi-weekly, or as needed. So we've been participating in a lot of things as a group, the sheriffs. The big thing now, we had been talking a lot about, not just the COVID, but also the election day security and where our forces would be deployed to help some of the towns that wanted to keep ballot boxes and things like that secure. So, the sheriffs have been working very, very good. The best ideas, don't necessarily come from any one of us, but collectively, here in Plymouth County, we've been very blessed in the sense that we haven't really dealt with large numbers, but some of my colleagues, in particular Essex County and up in Middlesex County, they have had those issues. And I do want to give a shout out. I would be remiss. The Department of Public Health has been phenomenal with all of us, by providing us the resources that we've needed. And they've been great. I did notice also there was a question that you had emailed me that I don't know that I've answered fully, talking about the numbers reported daily by Selectwoman Cavaco via Facebook, asking if it included prisoners and or patients at the detention facility in the state forest. Now, I can't speak directly to that because I don't know what numbers Betty is using, but I would go out on a limb and speculate. I think she's probably using the DPH numbers. And if she is using DPH numbers, the numbers of DOC and the sheriff's offices all collectively are also sent over to DPH. So yes, those numbers would be included in those numbers. So things are good, knocking on the wood here. Shout out to the men and women that work here and our inmates for being cooperative and following social distancing and hygiene rules. We've been very, very lucky, but I think it's the result of hard work. And I thank everybody. Thank you.
Thank you, Joseph McDonald, Plymouth County Sheriff. We're going to go back to Congressman Bill Keating's office. Michael Jackman, what would the Congressman want us to remember today?
Yeah, just to thank everyone for the information that they're sharing. As I said before, it's so great to hear from all the different levels and groups and organizations on everything that we're doing to keep people safe. If folks are having issues with federal agencies, please do give us a call at our Plymouth office, 508-746-9000. And make sure everyone votes. It's so important to have your voice heard, whether you send in a mail-in ballot, drop off your ballot at town hall, early voting, or if you go to vote on election day, which is next Tuesday, November 3rd, make sure you do it in a safe way. As Karen referred to, wear a mask and socially distance from other voters and other folks. I know the town clerk's staff and her staff are doing all they can to make sure that the polling places will be safe places for people to utilize next week. But however you have to do it, vote and make sure that your voice is heard. Thank you, Steve.
Thank you, Michael Jackman, District Director for Congressman Bill Keating. We're going to go back to Michelle Bratty, Director of Elder Affairs, Town of Plymouth. Michelle, your PSA was very memorable, involving people from our community and those people you serve. Your closing thoughts.
Thank you, Steve. And that was our town manager's idea. So leadership at its finest for all of us. I feel redundant, but I did want to end by taking a moment. Cal wants to take a moment for a very special thank you to PAC TV. PAC TV has been involved in community projects, not just during COVID, pre-COVID as well, every step of the way. There's not been one time when we have asked for help that we have heard a no from PAC TV, only a yes. PAC TV, you are the best, and we so appreciate your support. Thank you for everything that you do for us. Lastly, please vote. I'm right with you, Mike. Cal interviewed Town Clerk Pearl Sears to explain the soup to nuts voting process for our seniors or anyone else that wants information. Check it out on PAC TV. Without PAC TV, that video would not happen. So Pearl was wonderful, Cal staff were wonderful, and PAC TV captured it all. So you can go right to their website and look for it. Your voice is louder and stronger than you think, Plymouth. Vote and use it. Thank you.
Thank you, Michelle. Bratty, we're going to go back to Amy Naples. Amy?
Such amazing panelists as always. The leaders represented here are truly doing as much as they can to support the people of our community. And they are doing an amazing, wonderful job leading in their areas of expertise. And I'm, of course, so thankful to be a part of this panel and be a part of the collaboration with many of them. As always, as Michelle said, thank you to PAC TV. You are the best. You are keeping our community well informed. They are working like crazy and they never say no. They are the same with us and I think probably every other organization in town. And we are so thankful for all they are doing within their community. And of course, in the spirit of Halloween, I just want to leave you with this. Don't let our town become a ghost town. Carve out some time and support local.
Thank you. Amy Naples, she's the Executive Director, Plymouth Area Chamber of Commerce. We're going to go back to the closing statement from the State Representative Matthew Muratore. Matt.
Very clever, Amy, very clever. Well, I just want to just publicly thank the town, including the Board of Health, the Select Board, Karen Keane, for your leadership, the schools, the Chamber, Cal, all working together. We are in the red zone. We will get out of it. We're tracking numbers daily. They're looking a little better. But with this education, with the plan the board has put together, I think we will get out of this rather quickly. And we're going to need to stay out of it as well. So we need to continue to do that. I, along with everyone else, want to remind people to vote. I have my vote hat on that my friend Jonathan Bond had made for me and sent to me. I'm not sure why I need to wear it around because I think people know it's time to vote. So with over 60% of the people already voting, I think they know it, but I guess I'll wear it anyways. And I do want to clarify what the sheriff had to say as well. I think with some confusion with the numbers, and Karen, you can correct me if I'm wrong, but the numbers that come out of the jails, the state forest, do not get included in the town numbers. So if there's an outbreak in one of the jails, it does not get included. It goes by the town that the inmate lives in. So that's just to clarify that a little bit. And thank you to the sheriff and a great job that him and his team are actually doing during this time. And we can't forget the opiate crisis that's out there either. And the sheriff is on the front lines of that, along with our own police department. And it's not getting any better. It's actually getting a little worse. It's taken a little back seat and people haven't heard about it a lot, but it's out there. So we got to keep those folks in our minds as well to help them out as well during this time. And I think I'll go along as well with PAC TV. I've said this before. I don't know where we would be without PAC TV and the access stations that in our communities throughout the state. You are the folks that are keeping the communication together, particularly not just during COVID, but also during these election times as well. People are looking for the truth. They're looking for honest answers, and they're going to get it on shows like this through PAC TV. So we really appreciate what they're doing behind the scenes, 7 days a week, for everybody, every organization that you see out there. So thank you to Julie and Donna and the team for what they're doing. And I guess I just want to remind people again that controlling COVID is good for our economy. It's good for our health. It's good for our schools. The schools have done a fantastic job. Over 7,100 students, over 1,300 employees, and they have a handful of cases that aren't even transmitted from the school itself. So they've done a great job. And I know I get that question, why aren't the schools closing if we're in the red zone? Well, because the schools have done a fantastic job in what they're doing. And they need to be recognized as well. So, again, we talked last week about the resilience of our children. We need as adults, particularly young adults, 20 to 40-year-olds, can take lessons in the resilience from our children that are attending schools. So let's all continue to work together, be kind and respectful of one another, and we will get through this. We'll see you next week, Steve.
Thank you, State Representative Matthew Muratore. We're going to go back and conclude with the Chair of the Plymouth Select Board, Ken Tavares. Ken. And Ken, if you can unmute yourself and we're going to hear from Ken, and there he goes. He's unmuting. And go ahead, Ken. There you go.
So, I first want to start off by thanking Michelle and Cal for the PSA announcement. It was good to hear from people in the community that spoke with passion and sincerity, and that was important. Also, I want to recognize our students that worked on the skateboard wall. It didn't stay up very long, but my wife and I were so impressed with the enthusiasm of the students that put it together and watched them that evening as it came together and was sending a very strong message. I just want them to know that it was very much appreciated, and I know that a wall and paper doesn't go as far as what they are doing and talking to one another within the classes and within their own social circles. Thank you to them. As it gets towards the Wednesday each week, I look forward to the program because I know that I start to run out of some things that I should have, and they should be plentiful. But today I leave here with thinking that there was a great deal of common sense that was put out to us, and also the message of patience. So thank you to the people that have participated in this and in other programs. You're a great help to the community, and you have wonderful advice that carries us through for the next week. So thank you. Please vote. As others have said, our town clerk is ready with her staff. I'm sure we're going to have a very successful day on getting out the vote. Thank you all.
Thank you, and that's Kenneth Tavares. He is chair of the Plymouth Select Board. Next week, we'll be back here on Wednesday. We'll be joined by Dr. Philip Triffletti, Dr. Barry Potvin. We'll have a representative from the school department, also Stephen Cole. They'll be joining Ken Tavares, Matt Muratore, and me. A great panel today, lots of information. We hope that you'll listen and follow the advice from our experts and also from our leaders at the local, state, and national level. I'm Steve Triffletti, Plymouth Town Moderator. Thank you and good day.